The following program is sponsored by Accident and Injury Chiropractic and features medical questions from viewers. Nothing within the program establishes doctor-patient confidentiality.
Hello and welcome to Ask the Doctor. I'm your host, Mike Berger. We're joined today by Dr. Lou Saucedo of Accident and Injury Chiropractic and former football star Darren Woodson. And we're going to be talking about chiropractic and how it can help you. We would like to remind you that you can certainly join in. Just call the number that you see on your screen. That's 1-877-659-2211 or email to lsaucedo@accinj.com. Thanks for being here, both of you gentlemen. Nice to see you. Before we get started, I'd like to properly introduce Darren Woodson, of course, familiar to all Cowboy fans. You've been the spokesman for the clinic for 14 years.
14 years has been a long time. It's been an exciting time for the last 14 years.
And you've used it a lot of times.
Oh, no doubt. In my entire football career, I've had a relationship with accident and injury. I've always had that opportunity to be around professionalism. And they've always been professional. And not only after the games, but during the week, of just healing, trying to get my body back together, dealing with doctors like Dr. Lou here, and the rest of the team. They've done a great job for us.
And he probably does a lot for your shoulders when you have to carry around those 3 Super Bowl rings. They get kind of heavy.
He helps me out. He helps me out.
Okay. Well, you'll remember Darren, of course. He was called one of the hardest hitters in the NFL, one of the great players, and we want to thank him for being with us. Now, we're going to start out by learning a little bit about accident and injury chiropractic. Dr. Saucedo, just what is accident and injury chiropractic?
Accident and Injury Chiropractic is a chiropractic chain, a group of clinics that focuses on automobile accidents. We treat patients that have been in automobile accidents, that have soreness and pain from those accidents. We focus on traumatic injuries.
Very good. We're going to start out with a question from one of our viewers, and John in Frisco would like to know, I was in a minor accident and I'm a little sore now. Should I go to the doctor? And this brings up a couple of questions, doesn't it, Dr. Saucedo?
It absolutely does. A couple things. One, minor pain can be a significant injury. So it's very important. The first thing that you do is go be checked out by a medical specialist, a doctor that focuses on automobile accidents like we do, will help diagnose the type of injuries that you have in these accidents. We see a lot of patients that come in that say, I'm a little sore, but once we go through a thorough, comprehensive examination, we can tell them what's wrong with them, and once we find out what's wrong, then we can treat those symptoms.
What's entailed in that comprehensive examination when you see someone?
Sure. Before you, before you can treat a patient, you have to get a history. The history tells why they come to our clinic, what's bothering them. We get a thorough past medical history on any type of medical conditions underlying that might change what type of therapy that we do. And then from there, we do a comprehensive exam. We do a complete orthopedic, neurologic, chiropractic examination to be able to determine what type of injuries patients have.
Here's another email question that comes from Chris in Garland. I really don't have time to go to the doctor. Should I just wait and see if the pain goes away?
Wow, that is a very common question that I hear quite often. I have a sign in my clinic in one of the rooms that says 5 dangerous words. Maybe it'll go away. I hear that a lot, but a lot of times when you're in a traumatic injury or some type of injury like an auto accident, there's a lot of chemicals in your body that help you deal with these type of pains and anxieties. So what happens is you don't feel pain right away. And once the chemicals start to wear off, you start to feel the pain. Sometimes it takes 24, 48 hours. Sometimes you go to bed feeling okay and you wake up the next morning and you're sore.
Get a little sore. And Darren, it was real important for you to get in and get your treatments right away.
And I used to say those 5 words early on, but when I first met accident and injury, it was, hey, maybe the pain will go away. And they used to tell me, get your butt in here and get work going on. And I think that's what made it special for me is the relationship. Is knowing that the doctor's there that are going to care for you, the clinic is there that's going to basically get you that treatment that you need to have, and they're going to do it immediately. It's not a wait and see process. It's a proactive process. Get in, get your treatment, and move forward. And that's the reason I played for 13 years, and that's why I was so healthy.
Yeah, the difference between a long, treatment, and maybe treatment that will go quicker, is getting an early diagnosis and treatment better than prolonged.
I would imagine after about the 5th game of the season, Darren, you were in there by Sunday night, weren't you?
After the first game, Dr. Lou was dragging me in there.
We're going to take a short break. We'll be right back with a lot more questions. And of course, you can be part of all this. Just call us at 1-877-659-2211. We'll be right back.